So the first thought which a woman gets when she feels a lump in her breast or is diagnosed with a breast lump is of worry, panic, anxiety, thinking that probably she has breast cancer. Did you know most of the breast lumps are actually not cancerous? Did you know most of the breast lumps actually cannot be felt by hand? And most of the breast lumps actually just happen just like that without any reason. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today we will be talking about what to do if you are diagnosed with a breast lump. So today I have a special guest with me. He is Dr. Rohan Khandelwal. He is a senior consultant breast surgeon with more than 10 years of experience in his field. He appeared actually on Maitri last year when we spoke about breast pain, and that episode was actually appreciated by many of you. So today we talk in detail about breast lump.
Thank you very much for this opportunity, ma'am. It was a pleasure recording with you last time, and I'm excited about this video as well because we are talking about a very important topic which affects a lot of ladies.
So, Dr. Rohan, what is the first thing which a woman should do when she is diagnosed with a breast lump other than worrying and panic and anxiety?
So, ma'am, the first thing the patient should do is to visit a specialist, either a gynecologist or a dedicated breast surgeon. Now, we ask about the symptoms, since when are they suffering from the problem? Is it associated with pain or is the lump painless? Because that also conveys a lot of information to us. Do they have associated nipple discharge? Is there any family history of cancer? Because that has a lot of bearing on what kind of a lump this can be. Have they ever been previously treated for any breast disorders or have they had any breast biopsies in the past? Also very important for us is their menstrual history. Because based on the menstrual history, we can sometimes make out whether it's just a transient lump or this lump is there to stay and is a worrisome one.
That most of the breast lumps are actually non-cancerous. So if not cancer, then what are they?
Absolutely right, ma'am. More than 90% breast lumps are non-cancerous. But one thing which I would like to highlight here is that a patient cannot make out the difference.
Most
they
important.
do need to visit a specialist. They're of many types. The most common occurs because of hormonal fluctuations during the cycles, and the technical term for that is fibrocystic disease. And the patient usually comes to us with painful lumps just before the periods. And they say that once the periods start, the pain also subsides and the lumps also gradually go away. Another very common lump is a breast fibroadenoma. Jokingly, we also call it a breast mouse because it keeps on moving around in the breast, and that is what patients come and tell me.
Also, if a woman is breastfeeding, she may have a swelling of the milk ducts because of the accumulation of milk in the ducts, and sometimes if this milk actually gets infected, it can form a very painful lump. So in case you are breastfeeding and you have a painful lump, it's important that once again do not think it's cancer and visit your gynecologist or maybe the breast surgeon. Can a benign breast lump ever turn into cancer?
Yes, ma'am. There are certain lumps which over time do have a small percentage of cancerous risk attached to them.
Okay.
Like I mentioned, a fibroadenoma, that also has a 1 to 2% chance of malignant or cancerous conversion.
What is the triple assessment?
So any patient who comes to the clinic gets a detailed history taken. Some of the points we've already mentioned in the video. After that, we do a thorough breast examination, and post the breast examination, we do an imaging. Now, this imaging test would vary depending on the age of the patient. Younger patients have dense breast tissue.
Yes.
So, mammography, which is the standard test, is not very sensitive in them. it does not show us all the details. So for young patients who are less than 40 years, we usually do an ultrasound. And for those who are above 40 years, we do a mammogram, which may or may not be clubbed with an ultrasound.
What is actually dense breast?
So the breast tissue is comprised of two things. You have the gland, which is basically there to produce milk, and there is fat as well. So in a young lady, there is more glandular tissue and less fatty tissue. So that is why we say the breast is more dense. But as the lady ages, the glandular tissue reduces and the fat component increases. So the breast becomes more fatty as the lady ages. And please don't think that because mammogram is associated with radiation, it will increase your risk of cancer. That is a myth.
Yes.
The amount of radiation is very low, and even if a lady gets a mammogram every year, that is not going to increase the risk of breast cancer.
Usually mammogram reports come with a score, which is a byrad score. What is that score?
This byrad score has been designed so that there is standardized reporting of breast imaging. It ranges from 0 to 6. 0 means that additional imaging is required. The radiologist could not see entirely and they need more imaging. 1 and 2 are essentially normal. You don't need to worry, you need to come back after 1 year. 3 is when a short-term follow-up is required. We call the patient back after 6 months. 4 and 5 are highly suspicious and they need a biopsy. And byrad 6 is when a biopsy has already been done and that has proven that it is a cancer.
Okay. So now coming to this question of biopsy, I know every patient gets scared even when we advise them or try to send them to a breast surgeon. You know, they are so scared to get a biopsy done, and they, invariably say that biopsy probably might either increase the size of the lump or can lead to spread of cancer. So I really want you to dispel this myth completely.
So that's a very common misconception, ma'am. But I always tell patients that unless I do a biopsy, how do I know whether the lump is cancerous or non-cancerous?
Absolutely.
So sometimes what happens is that when we do the needle test, there is some inflammation which occurs after that. And the patients perceive it as an increase in size of the lump. But in reality, it's just the inflammation which usually subsides after a few days.
So on record, biopsy does not spread the cancer, nor does it lead to increase in the size of the lump. Do all lumps need to be removed? That's the common question. Coming to the treatment, like once you have done all the tests and everything, do we have to remove all the lumps?
So as we said, ma'am, majority of the lumps are non-cancerous. And these non-cancerous lumps also, majority can be managed without surgery. Certain lumps require surgery, like fibroadenomas, or if it is a milk collection, if it has formed into an abscess where there is pus. So fibroadenomas are the most common cause of a breast lump. And the common indications for surgery are if it is causing extreme pain to the patient, if the size is more than 2.5 centimeters, if it becomes a cosmetic problem for the patient, if there is a family history attached.
Yes, very important point. So recently there was a very big news about a celebrity undergoing a mastectomy, that too a preventive mastectomy. So what is mastectomy? It's removal of breast. So that was Angelina Jolie. So what's your take on that? So should a normal person who has a family history of breast cancer should undergo a BRCA testing and then a preventive or a prophylactic mastectomy?
Right, so Angelina Jolie's case created a lot of awareness regarding this BRCA gene, which was missing earlier on. But having said that, not every patient with a family history of breast cancer requires this test. And something which patients should understand is that the index case, that means the patient in their family who had breast cancer, they should be tested first for BRCA. Like in Angelina Jolie's case, her mother and her aunt were tested and then she was tested. So if the index case is not positive for BRCA, then the family members need not be tested.
Correct. So now, most important, what's your take on the self-breast examination? How frequently should it be done, and when it should be done, and what is the information they can get out of it, and what are the danger signs other than a lump? Also, there are a lot of things which a woman can find out when she is examining herself.
Right. Considering the Indian scenario, I personally feel that ladies should carry out a breast examination. The terminology now is known as being breast aware. So whenever they get a chance, they should feel for a lump in their breast. And I saw a very informative video on the Maitri channel, which you had posted some time back. And I think so all users should go through that video to understand the benefits and the procedure, of breast self-examination. Like you mentioned, that there are certain danger signs which patients should be aware of. Like I said, any lump which is persisting beyond one menstrual cycle, that should not be ignored. Majority of the breast cancer lumps are painless. This is another thing which I want to put across to patients, that they are painless. That is why the cancer keeps on increasing without the patient knowing about it. So don't ignore painless lumps. If you notice a bloody nipple discharge, that is again a danger sign. If you notice that the skin has become thickened like an orange peel, or if you notice lumps in the underarm region,
very important,
or you notice a recent change in the shape or the size of the breast, all these are danger signs associated with the lump, and you should immediately rush to the doctor.
So if you are diagnosed with a breast lump, most important is do not jump to the conclusion. It's important to find the right doctor, seek an appointment with the right doctor, get yourself investigated and get the proper treatment done. So today, like always, if you found this information useful, please do not forget to like, share and subscribe to Maitri. Please do not forget to follow us on Instagram, Twitter and LinkedIn. And we hope to invite him once again for some more sessions on the breast health, and we will see you soon.